Previously on Health Now.
I'm happy that we are discussing this in a Christian setup.
Okay.
Because sexual violence is something that people don't want to talk about.
Yeah.
Because it is attached to shame and guilt.
Mm-hmm.
And that's why when people go through rape
Mm-hmm.
or sodomy or defilement, they don't talk. So what they do, they suffer from inside. Why? Because if I would talk, and this is a very sensitive topic, I look like I am the one who made myself to go through it. But it's good we are here to talk about it.
Yeah. Welcome back, our viewers. We'll continue with Becky.
Yes.
And before the break, you were talking about grooming, you're talking about defilement. I feel that we probably need to go back a bit on the grooming aspect, because what we are finding in families is the grooming part that may be happening behind these closed doors of our houses, those parties that you're mentioning. And us as parents, we may not be aware. So what are some of the signs that we need to look out for in the grooming? Kindly.
Thank you so much, Jane. It's true. And yeah, we don't have to push parents like they knew. Some of these things they don't know. And maybe some of the things that we need to tell parents, and I have seen very common, so many young children would sit on the lap of adult men or even teenagers. And you know what is happening? They are scrubbing their private part on that girl. And they are gratifying their sexual need. And as they do that, of course, even there are other arousals to these young girls, their feelings. So there is that confusion with this child.
Yeah.
That's why we call it grooming.
Yeah.
Because she's feeling something good. She's feeling something, I don't know. There's a confusion.
Yeah.
And so that's why we also tell parents, when you see these two young children always running to the lap of these adult men, and not all of them, so that we don't again criminalize everyone.
Yeah.
But it's, as a parent, it's good to be sensitive. You know why? So many people, even as we are growing, so many people went through that.
Yeah.
And
I shared my
yeah,
example.
and that haunted them even in their adult life, even in their intimacy
Yes.
with their partners.
Yes.
It affected
Yeah.
because of this confusion. Again, even when they go to those bashes,
Yes.
you will find because of those, I said, first of all, there's a lot of spiking of their drinks.
Yes. Yes.
Some of them have not even taken the hard drink. Even in those soft drink, when it's spiked, then they are sometimes there is no penetration.
Yes.
But they are touched, they are groomed. There's all that.
Yeah.
There's all that touching, and it ends up again to molestation and sexual violence. So as parents, we need really to be sensitive. We need to be careful on our daughters and our sons who is touching them. Some of those touch looks like they are normal, but it's good to be a bit careful. And I'm not saying that parents need to be paranoia. No. But I'm saying, as a parent, it's good to be careful, especially now that we are living in a digital world, whether we like it or not.
Yeah.
It's a digital world.
It's true.
And we need also to be extra careful.
True.
We don't need to be naive as parents, and even the children out there.
Yeah.
I mean, talk. The reason why they are not talking is because also the adults are not talking about it. And also, as parents, believe when your child tells you. And in part of believing, and this is where maybe we need to tell parents, is don't victimize your child. Because I'll keep on saying, because this is what is happening. Guilt, shame is put on that child. So they fear and, they shy away from talking about it. Yeah. Let me not forget about talking about sodomy, because we keep on forgetting our boys and men.
Thank you.
And it's part of sexual violence.
True, true,
And you
true.
know, I'm a mother of boy.
Go ahead.
So I start by giving this example.
Yes,
I said I was employed 10 years ago.
yes,
So I was employed. I knew about rape.
yes,
I could read about rape.
yes,
I could see in TV.
yes,
But I had not fathomed literally
yes,
that, okay, what is this rape?
yes,
And I knew steps that you're supposed to take through a survivor.
yes.
Because in books I was taught.
Mm-hmm.
But now book
Book-wise.
wise and TV wise.
The TV wise.
Now I get
yeah.
employed
Mm-hmm.
at Nairobi Women, and I'm a junior counselor.
Mm-hmm.
And so I have been attached to a senior counselor.
Mm-hmm.
And my first client was a boy. You know,
Mm-hmm.
I was shocked like anybody else.
Yes.
And so I asked the counselors who are on duty,
Mm.
are you talking about a boy?
Uh-huh.
A boy being raped,
Mm.
sodomized?
Mhm.
How?
Mm.
And so I always say, and I have written an article on that, and I have presented in conference,
Yes.
that the first thing I did, I became an investigator. I forgot all that I was trained in school because I couldn't fathom how can a boy, how? And I was asking the mother, ati ali ilifanyika wapi? Like I even want to see. And I remember, because how we work in our organization, once we finish, we take them to the doctor. So for me, I didn't take the child to the doctor for treatment, just to see, you know? And I know I am speaking to people who were like me,
True.
who don't believe that men and boys. And from there, I went to check on my son, because he was a young boy by then, and asked all the million questions. So I want to tell parents that boys are going through a lot of sodomy, and even men. And our boys can't talk. Why? Because they are finding parents like me who could not believe. And their rape again, or sexual violence, is through the anus. And remember, it's also very painful. And it's a violation of human life, just like the girl.
True.
And we have so many
Mm-hmm.
boys who have passed through my heart, and men who are going through sodomy. So as parents, let's not only check out on our girls,
Mm-hmm.
we also need to check out on our boys.
Mm-hmm.
And it is very common.
Mm.
Now it's even common in primary school and in high school.
Mm-hmm.
Remember, they were groomed.
Yes.
Remember, they have watched
Mm-hmm.
pornography.
Yes.
Remember, they are into masturbation.
Mm-hmm.
Then they are practicing it. So it is very common, and they are going through the trauma the girl would go. The male, our brothers, have also been sodomized as they leave their work. Just the way there would be a car would be hijacked, and women would be sexually violated, be raped. The same is happening to our men. And we need to give them also space and forum, and not doubt them, and listen to them, and give them that space of healing, because they have also lost their dignity. We're talking about Rose.
True.
They have also lost their human dignity.
True.
And they are going through the phases like the girls.
Yes. One time in my training, I did medical sociology. And one of the key things that I learned that time was that men are poorer in seeking for health. They are poor health seekers because of the many things that, like you are talking about. Probably I'll go and say this. I'll be looked that this way. They are quiet. What would you say about that?
Of course, because of socialization,
Mm-hmm.
and there is what we call the male dogma, and they believe
Yeah.
a man is strong and should not talk.
Mm-hmm.
A man should not cry.
Mm-hmm.
And so, how were you raped? How? You are a man.
You are a man.
Why couldn't you defend yourself? So all that equals to a man keeping quiet, and the male ego, and this male ego have been fed by the male socialization. Even as mothers of boys, what do we tell our boys when they're growing up?
Mm-hmm.
You are a man.
Yeah.
Style up.
Mm-hmm.
You can't cry.
Mm-hmm.
And the same age of their girl, We tell them express your emotion.
Mhm.
And remember, a man is a human being
True.
who has emotions,
Yeah.
who, who is a human with all the human aspect,
Yes.
who go through. We need to give them platform and allow them.
Yeah.
And this is what I tell men. Men, please don't cow into those socialization. A man loses their mother and they're supposed not to cry. They're supposed to
They're
cry
supposed to
and
cry.
express their emotions
Mhm.
and their pain.
Mhm.
But as of course, as human being, as citizen, we are the people who have put all these, and we need to allow our men to talk.
True.
Yeah.
True.
Yes. And now from there, I think the other question you asked me now, okay, so what? We've
Yeah.
gone through the sexual violence.
Yes.
So what?
Mhm.
So the first thing we have to know, when I have gone through sexual violence, whether an adult, whether a child, is my right have been violated. Okay? As a human being. That's why we say it's a violation of human rights.
Yeah.
The second thing, I have lost dignity.
True.
I have lost self.
Yes.
That is the so what.
Yes.
And in losing all that, I develop now other things that we call trauma.
Yes.
And the reason I develop trauma is because of that loss. It's because of that bitterness. It's because of that pain I have gone through. So there are two types of pain when I go through sexual violence, or anyone goes through sexual violence. The physical pain, and that is what we take to the hospital
Yes.
for medical management,
Yes.
and the emotional pain.
Yes.
But before I come there, I know people would ask, so what happens?
Mhm.
So this is what we want to create awareness to people out there.
Yes.
Anytime a sexual violence happens,
Let me interrupt you,
yes,
Becky. Just look into the camera as we are talking this, because this is for us, all of us.
sure,
Kindly just yes.
yes.
Yeah.
Now, anytime a sexual violence happens, the first thing that should come into the mind of anyone is you rush to the hospital before 72 hours. Why do we say that? Because before 72 hours, we are able to reverse so many things. Because if the person, the perpetrator is the person who is violating or is causing the sexual violence. If he was sick, if he had HIV, STD, and all those diseases, within 72 hours, we are able to treat you. And the hospital, I don't only mean Nairobi Women's Hospital.
True.
I mean any hospital near you, especially the government facility.
Yes.
And the services are free. I've been part of the people making the policies
Yes.
in this country. And
Yes.
I'm happy
Mm.
that to say that all the services of sexual violence are free.
Yeah.
And we have so many trained practitioners. So within 72 hours, we are able to reverse. You're able to be given medicine that will reverse anything that you could have contracted: STIs, STDs, and HIV.
True.
Now,
We're talking
ladies,
about a minute. We're talking about 72 hours. That it's about 2
from
days.
from the time it happens,
Yes.
two, but the best time is immediately.
Immediately.
But we say that we know there are situations that you are not able to rush
Yes.
to the hospital.
Mhm.
But before, that's why I'm using the word before.
Yes.
Then the other thing, for the ladies within their menses,
Mhm.
you be reversed, you not be pregnant.
Mm.
There is medication for that.
Yes.
And then, of course, there will be the psychological debriefing
Yes.
immediately.
Yes.
Then the other thing is, we tell people out there, and this one they need to hear,
Mhm.
if they have to access justice,
Yes.
don't shower. Don't change clothes. When you come to health facility, we will help you with other. I know people feel dirty,
Yes.
but for your own sake, when we are able to harvest evidence, when we swab and all that, it's easy for us to harvest evidence within that time. But the best thing we say, even 48 hours. However, let me put a disclaimer here, especially to the ladies within their menses. 72 hours are over. then you are there and saying, Becky said, if it's after 72 hours, I cannot go to the hospital. You still can go to the hospital.
Yes.
Because, again, for us to prevent pregnancy, this is for pregnancy only. 120 hours. We can prevent pregnancy. For pregnancy only. But for other services, is 72 hours. And we call it the 72-hour campaign. Rush to the nearest health facility, the nearest with you.
You've said don't change the clothing.
Yes.
Talk more about how do I now come to the place and I feel dirty, as you've said. I feel dirty, I feel defied, I feel, all this. I'm feeling like I can't even go, go outside. I'll probably the first thing is to change my clothing.
Mm.
So how do I get, I mean, that my clothing intact to the
Okay.
health facility?
Sure. Why we request you to come with the clothes that you are wearing?
Yeah.
Because we want to correct evidence. Because with your clothes, we are able to indicate that her or his clothes were torn, and we have the evidence here with us. However, I know sometimes it's very hard to come with those torn clothes. When you change the clothes, please put them in a bag that does not sweat.
Not a plastic
Not a
bag.
plastic bag. Come with it. That is an enough evidence.
I guess, Betty, go back to that point
Yeah.
again. Because that is where some of us, or some of the people that may be watching us, I have not gone through rape, but some of the people I've listened to would say that I put it in a paper bag. And Kitabo Kidogo, we used to have those plastic bags. So you're telling us we don't need to put them in the plastic bags. So how do I pack my garments?
You see, there are these bags. For example, if you don't have any bag near you, you can use the Uga bag. You know that Jogo,
Yes.
such
Yes.
bags, you can
Yes.
use them, or you can use newspaper. But we try to discourage newspaper, because if the health facility is not near you and if it sweats,
Yeah.
remember what we are looking for is evidence.
Yes.
Why? Because the perpetrator was touching you. We are able to correct that using that. That's why we keep on saying, bring it as it is.
Yes.
You can even wrap it with another cloth and bring it.
Yes.
If you have you have changed.
Yeah.
But also, if it's okay, don't even go to the toilet, because when we take that urine, it gives also us samples. The reason we also say come immediately, because maybe some people are struggling.
I'm imagining before we get there, the urine is going to sweep a bit of
Yes.
the evidence.
Yes.
Okay.
And when now we correct that urine, we can, because what happens,
Mm-hmm.
the spermatozoas
Yes.
are able to rust in a woman's body within 72 hours. So we are able to correct it and see. That's why we really insist on 72 hours.
Yes.
And again, there are many areas we can correct evidence. Your work is just to come to the hospital. I don't think I need to explain that. But it's easy for you to access justice.
Yes.
If you're able to come to the hospital and then report to the police.
Yes.
And that's how we work together, the police and the hospital.
Yes.
Because we correct the evidence,
Yes.
we handle them to the police.
Yes.
So the police will do their work.
So the legal part now will be helped and supported by the evidence that you collected within the 72 hours.
Yes.
Okay, go ahead.
So yeah, that's what I have said. Now the other critical part, that was medical, which is very critical, is here.
Before we get to that, our viewers, she is really telling us what we need to do. What are the next steps? How we need to move. I'm sitting here listening to her, and I'm telling myself, I'm learning, I am learning. And I believe you are also learning something. Go ahead, Betty.
Yeah. Now, like I said, medical part is very critical, but we don't want to leave it. We don't leave it at medical part. We also want to come to the mind, because once you go through that violence, if there's anything that is literally affected, is your mind.
True.
Because like I said, you have gone through a loss of your own dignity. There is all that 5 phases. There is anger. There is blaming. I wish I never passed that route. Where was God? Actually, so many people have hated God. Why didn't God send angels? There's all that. And that is normal. If that is not attacked, it haunts you. You go with it. And that's where now, during the break, I was sharing with you, and I was telling you, a lot of marriages I have seen myself have been, especially the intimacy, have been affected because many children were defiled. They were never helped. And so they grew hating intimacy. But now, because of society, of course, we have to settle. So when we settle, I don't know whether you have had people who are divorcing immediately after honeymoon.
True. I have.
Yes, there are many.
Yes.
Or they have a lot of challenges, marital issues,
Yes.
but they can't talk about it.
Mm-hmm.
But if you look at the genesis, is where they went through the sexual violence. They tend to hate in their mind. They grew knowing this thing is bad.
Mm-hmm.
And as they knew this thing is bad, when they practice, it's painful. There's a lot of, again, anger. You remind me what I went through. You look like him or you look like her. And the marriage is full of issues. So that's why we really encourage, and we are going to encourage our viewers, go for therapy. So that is the next phase.
Yes.
Go for therapy and go for professional therapy. I know we have many professional counselors, and even in those health facilities, some of them, because they are at lower level, they will escalate.
Yes.
And I'm happy the government is employing a lot of counselors.
Yes.
And I'm happy the churches are also employing professional, because we have moved from for prayers and counseling. Now we have moved to people are valuing professional counseling.
True.
And the person will walk the journey.
Yes.
And it's not an easy journey, because first of all, you are forgiving yourself, and you're the one who have been defiled. You can imagine. And you are forgiving the person who did that. And you are forgiving the whole society who came even to see who had been raped.
Mm-hmm. Mm-hmm.
So it's a combination, and you need someone to hold your hand to walk through the journey, a journey of healing. Like where I work, it's a journey of 10 months. We have a program of 10 months.
Mm-hmm.
You have to be in that program for 10 months, and then you exit after 10 months. And that's where we say we have been able to help you recover.
Yes.
Now you move from a victim to a survivor.
Mm-hmm.
Because our work is, and our purpose is to bring back meaning to your life.
Mm-hmm.
Because you have no meaning.
Yeah.
You hate everyone and you hate yourself.
Yes.
Because of losing your dignity.
Yes.
Yeah.
Well.
It's hard work.
Mm-hmm.
And allow me to tell parents,
Yes.
most of the time we keep quiet
Mm-hmm.
because you don't want people to stigmatize you
Mm-hmm.
that ule mtoto wa fulani ambaye alibwakwa.
Mm-hmm.
And especially in mother tongue, it's
Mm-hmm.
even worse.
Mm-hmm.
Kwa mama fulani,
Mm-hmm.
kuna yule mtoto ali,
Mm-hmm.
and we are addressing you in that. You can imagine. Imagine.
Yeah.
You can imagine the stigma to the parent
Mm-hmm.
and to the child.
Yeah.
So I tell parents,
Mm.
we forget about stigma. Let's help this child, because by the end of the day, the more you keep quiet, the more it eats you as a parent and it eats you as a child. And let me say this, most of these children, as they grow up to teenagers, because of the pain, they look for ways to deal with the pain. Some of them have become sexualized. I don't know whether you have seen teenagers who are having sex with different multiple partners.
Yes.
And they're young.
Mm-hmm.
It is a way of dealing with the pain that, and especially we've seen young children who are defiled by people who are close to them.
Yeah.
Their dads,
Mm-hmm.
their stepdads,
Mm-hmm.
their brothers, their
Mm-hmm.
uncles.
Mm-hmm.
Because they were not able to say and they're feeling the pain,
Yeah.
they look for a way to cope. And sexualization becomes a way of coping. And we continue judging them and calling them names, and the parent can't understand. So they run away. So we need to bring them back and understand where is the problem. So we really want to say, it's good, come for help. The church is open for help, right?
Yeah.
I know you're existing because you can help.
Yes. Yes.
Come. And the good thing with psychologists, they will not tell anyone. There's
True.
a lot of confidentiality.
Yes, yes.
And even for young children, there's a lot of therapy for young children, art and play therapy.
Yes, yes.
It is existing. So we know how to tell them.
Yes.
Yeah.
Wow, Becky. We'll come back and we're going to look at, yes, we have seen the next steps. We're going to look at what are some of the consequences. You've mentioned a few, but we're going to look at what are some of the consequences that this person, this individual who has gone through either sodomy, who's gone through defilement, who's gone through rape, have,